The composition of the blood, when you look at whole blood, the blood that we would draw in a test tube to do a CBC or a chemistry, there's two components, and we can centrifuge the blood so that we could separate it into the cellular component and the watery component. And within the watery component, we have proteins as 7% and 92% water. The other is red blood cells. These are the formed elements. They also include white blood cells, platelets. All of those are a part of the formed elements of the blood. The white blood cells, the leukocytes, we use those two terms interchangeably. White blood cells, the primary groups, monocytes, lymphocytes, and granulocytes. The granulocytes are part of the innate immune system. They are the first line of defense. The monocytes are that population of cells that will participate in the immune reaction as macrophages. And the lymphocytes are that cellular component that will be part of the adaptive immune system, the T cells and the B cells. The major component of the granulocytes, the neutrophils, are perhaps the most important phagocytic cells in the body. They are cells that will kill bacteria, viruses, and other foreign invaders that enter the bloodstream. And they are a cell component that we sometimes will measure separately, the ANC count, because that number is very, very important in terms of the ability of the body to fight infection. Eosinophils and basophils, they are a type of granulocyte, but you see relative to the neutrophil, the numbers are much less. Eosinophils only 2% of the number of granulocytes, and basophils 1%. The eosinophils, these cells can phagocytize parasites. Basophils are very important in the allergic reaction. The basophil releases chemicals such as histamine and heparin, but all of these cells have a role in the innate immune system. When you look at the plasma component of the blood, is the solutes, which are a part of the plasma. Notice what's there: amino acids, glucose, lipids, so the nutrient components, also the electrolytes, sodium, potassium, calcium, all of the major electrolytes are part of this, and then metabolic waste. Vitamins and hormones are also, and if we look at in the plasma at the top 7%, so the protein component, now we're talking about some of these larger macromolecules, immunoglobulins, IgA, IgG, IgM. These are examples of antibodies, secreted antibodies that are present in the plasma. The other globulins are for transport. They are reactive proteins. We have proteins that are important for clotting, and we have factors, for example, and then we have transport proteins, which are listed here. Is albumin. That is critical in terms of its transport. Really a good slide with a lot of data. Albumin has many roles, not only in hormone transport, but also in drug transport. Hematopoiesis is where our blood cells come from. So you may remember looking at a bone and noticing that central cavity, that is the bone marrow, and that's for active production of blood cells. Besides the long bones, the sternum, the ribs, the vertebrae, the pelvis, and the ends of the long bones are sites of production for blood. This is a breakdown of cell formation, and you notice that we start with a myeloid progenitor cell and a lymphoid cell. And from these two stem cells, all of the other cells will develop, differentiate, mature, and form this line of cells that we're very familiar with. The granulocytes are shown at the top here, and you see the basophil, the eosinophil, and the neutrophil. Notice that their origin is the myeloid cell. The other two cell types that I want to mention, the platelets and the red blood cells, which are involved in the red blood cells carry oxygen and CO2. The platelets are responsible for clotting. The monocyte is very important in the immune system. It participates in phagocytosis, the first line of defense for the body. It is from the myeloid progenitor line of cells. The other line of cells, the other lineage, if you will, is the lymphoid group. The final mature cell type, the T cell, the B cell, and the plasma cell. These cells are involved in cellular and humoral immunity. They are part of the adaptive immune system. You may remember from anatomy and physiology that we have an innate immune system and we have an adaptive immune system. The innate immune system is our first line of defense. The adaptive immune system is that immune system that responds after first being shown an antigen. It takes longer to process, but it gives a more sustained, amplified response to pathogens that are presented by the primary cell line.